A very pretty case which was very kindly shared with me by Dr. Antonina Kalmykova of CSD Healthcare in Kyiv, Ukraine. And it's particularly interesting because it raises a series of differential diagnoses. But let's begin by looking at the lesion. And here's the lesion in the center of the specimen with normal epidermis on either side. And there's a sort of a cup-shaped depression from which there are arising papillary structures, which I think you can see quite easily on this low power view. So let's look at it in a bit higher magnification. And one can see that there is hyperkeratosis, perhaps an element of parakeratosis, and then this transition to a papillary structure in the middle. And we'll look at this in higher power view again. Now what we can see here is that there is suprabasal acantholysis. And we'll just go to a higher magnification there. Now that's a perfect field for what this lesion actually is. So we have papillary structures projecting into an empty cavity. There's acantholysis along the sides of the papillae and on the floor of this lesion. Above there is parakeratosis and some rather large hyperchromatic nuclei, which I think we could regard safely as the grains of Darier. And then over to the left, a perfect vacuolated cell with the nucleus shoved to the side. And this is a typical core rond. So we're looking at an acantholytic lesion with grains of Darier and core rond formation. Now, what are the differential diagnoses? Well, these would include Darier's disease, particularly if this was just one lesion of very many. It could also represent Grover's disease. If it was a solitary lesion, then it might represent a warty dyskeratoma or possibly an acantholytic acanthoma. And we might also remember that sometimes, I'm just going down in magnification, sometimes you can see acantholytic changes with core rond and Darier's as an incidental finding in association with another lesion, such as the dermatofibroma, and then we talk about focal acantholytic dyskeratosis. Now, this is a solitary lesion, and so I suppose the two differentials that are most important are, well, most reasonable are warty dyskeratoma versus an acantholytic acanthoma. Now, a warty dyskeratoma arises within the wall of a cystic hair follicle. And in this lesion, I don't see any evidence of any follicular structure. I'm just going to go down to the lowest part because we've got these two pieces of skin here that perhaps I'll have a squint at. You can't really make much of it. There's a fragmentation, but we don't see a hair follicle there. And the same thing applies on the other side. So there's nothing to suggest follicular involvement. And so at the end of this, my diagnosis would be a acantholytic acanthoma. I hope this has been helpful to you. Thank you very much.